My name is Maddie Frank, and today I'm going to be teaching you about cognitive behavioral intervention for trauma in schools. So, a little bit of background about this intervention. Cognitive behavior intervention for trauma in schools, also known as CBITS, was developed by a team of clinician researchers based in Los Angeles, California, in response to the rise of exposure to traumatic events among youth. It has been reported that more than 1/3 of U.S. children report being victims of physical violence just in the past year. And more children will experience natural disasters, witness violence, have severe accidents or injuries, or experience a traumatic loss. And so, while most of the children will recover from the initial distress caused by these traumatic events, there are many who continue to experience distress months later. So, trauma exposure can lead to problems such as alteration in mood and behavior and loss of social and academic functioning. And this can in turn lead to children developing post-traumatic stress disorder or PTSD. So, a little bit more about post-traumatic stress disorder. According to the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, PTSD is defined as a set of symptoms that persist at least 1 month following traumatic exposure and includes the following criteria. So the pictures here include all of the criteria that one would need to meet the diagnosis of PTSD. But CBITS focuses specifically on 4 symptoms, and those symptoms are re-experiencing the event through intrusive thoughts or nightmares, avoidance, for example, avoiding thinking about the event or avoiding trauma reminders, negative cognition and mood. So, for example, students might have self-blame or develop a lack of interest, and arousals, though students might have trouble sleeping or hypervigilance. So the structure of CBITS is designed as an early intervention for children 4th grade through high school who are showing those symptoms of PTSD. And this intervention is a series of group sessions that uses cognitive behavioral skill building to reduce symptoms of PTSD, depression, and anxiety. And the structure of the intervention consists of the following. You'll teach 10 student group sessions, 1 to 3 individual student sessions, 2 caregiver sessions, and an optional but highly recommended school staff informational session. So the goal of CBITS are to reduce current symptoms related to trauma exposure, build skills for handling stress and anxiety, and build peer and caregiver support. So to meet these goals, kids will be building skills for handling stress and anxiety and building that peer and caregiver support. And to accomplish these goals, school counselors will teach psychoeducation about trauma and its consequences, relaxation training, learning to monitor stress or anxiety levels, recognizing maladaptive thinking, challenging unhelpful thoughts, social problem solving, creating a trauma narrative, and processing the traumatic event, and facing trauma-related anxieties rather than avoiding them. So CBITS uses a model of thinking to engage students in using specific skills to address the thoughts, feelings, and behaviors that come with trauma. And so a triangle model has been created as a visual way to show how trauma can affect each of these specific areas. So students will think in the middle is where our trauma, stress, and violence that we've experienced is held. And then we have what do we think in response to this, how do we feel in response to this, and what do we do in response to this stress, trauma, or violence. So getting started with CBITS. So CBITS offers several forms of training, and schools can choose to have live training with a certified trainer or complete online training through their website. And with live training, staff will complete 12 hours of training over the course of at least 2 days at their school. There is also now a virtual option via Zoom where trainers will deliver the training through 4 3-hour modules. The online training provides videos and materials on the clinical skills needed to deliver the intervention. And the online training courses also provides 5 hours of continuing education unit credits approved by the American Psychological Association and National Board of Certified Counselors. So with all forms of training, it provides the following. You'll learn the overview of child trauma and PTSD and the mental health and academic consequences, a review of the history and evidence base of CBITS, thorough session-by-session demonstrations and supervised practice of each core concept for child group and individual sessions, including how to make the material culturally and contextually relevant to the audience, review of the parent and teacher sessions, and engagement activities around implementation issues and site planning. The cost for CBITS really ranges from being free to upwards of over $4,000, depending on the level of comprehensive training you choose. The online training videos are free, and live session prices varies on the number of training days that your building chooses. Materials that you'll need are through the website. So you will need to create a free account. With this, there is a free download of the training manual, or you can buy a copy for $34. Their website also offers free downloads of fact sheets, training guidelines, sample materials for sessions, translated materials into multiple languages, adapted materials based on cultural needs, age, and academic needs, and also provides evaluation articles of the program. There is also an online community of experts and a collaborative workspace for you to engage in. So really, their website is a great one-stop shop for all the materials needed to begin using CBITS in your building. So forming groups. Once you have finished the training and reading the manual, you'll begin to form your intervention groups. So these groups should be formed at the beginning of the school year, as the intervention will be 10 to 12 weeks long and will take place once a week for a minimum of 45 minutes. And the reason you'll want to start at the beginning of the school year, besides the length of the intervention, is you will also want to consider when you are pulling students and what content they might be missing. And studies have also showed that early intervention has a much greater positive outcome than delayed start to the intervention. So once you get started, you'll need to identify the students in need. And to do that, you'll give a general trauma exposure screener. They give an example of a screener that you can use through their website, and the manual also provides some other resources of different screeners that you can use based on your school's needs. So you'll develop a cutoff score determined by your school, and then once you have received those scores, you will begin to interview students that score at a significant or clinical level. So thinking about Tier 2 and Tier 3 students. And so this interview will allow you to review and confirm students' responses, introduce the program to them, and gauge their interest. And the number of groups formed will depend on the environment in which you serve. Some areas may experience more trauma, such as gun violence or natural disasters, than other areas will. And so it's important to keep your school's culture and demographics in mind when forming groups. And this will also help you in identifying students that are truly Tier 2 and Tier 3. And once you start forming those groups, you should have about 6 to 8 students that are similar in age and in culture. Again, you'll have caregiver and staff sessions. So once your students have been selected, you'll need to host at least one caregiver and one staff informational session. And these sessions will allow you to review the core elements of the intervention and how they can support their students. And this is also a great opportunity for you to answer any questions that they might have. And it's important to hold these sessions as students will be learning skills that they'll use while they are at home and in the classroom. And something that's really nice is that the caregiver and staff sessions are already planned out for you and available for use in the CBITS manual. So once you've started forming groups, you'll begin the student sessions. And the CBITS manual provides you with all the necessary lesson plans and materials needed to carry out this intervention. When you get started, it is suggested that you review the session's agenda first, so that way students are being front-loaded with the topics being covered. Again, these students have experienced trauma, so by going over the agenda first, you are helping to reduce stress and anxiety that students may form with wondering what they are going to be learning about. The agenda, objectives, and supplies are all listed clearly for you in the manual. The session is then broken down and parts are even scripted, so you are making sure you're implementing the intervention with fidelity. You'll start with 2 group sessions to allow the students to get to know each other and learn what CBITS is. And then you'll run 2 to 3 individual sessions to evaluate each student's individual trauma and develop a baseline understanding of their symptoms. From there, you will run 8 whole group sessions where you will teach skills on how to understand thoughts, feelings, and behaviors associated with trauma. So here is an example of a session. So this picture shows you what the front page of the session will look like. Again, you have the agenda laid out for you, the objectives for this specific session, and supplies that you will need. So today we are going to practice a relaxation technique that is used throughout the program and interventions. And so the goal of this part of the session is to train group members in deep breathing, positive imagery, and progressive muscle relaxation. So we are going to practice this skill together. So if you want to make yourself comfortable by either sitting in a chair or laying down maybe on your couch, or if you want to lay down on the floor, whatever is most comfortable for you. So stress makes our bodies tense, and feeling nervous or upset makes it even worse. But there are ways to relax your body that will make you feel calmer. Today, I'll teach you one way to do that. I'd like you to start by thinking of some place that makes you really comfortable, like a comfortable chair, or the couch, or even the beach. So close your eyes and imagine that you are lying down there or sitting comfortably. Take a breath in and let it out. Take another deep breath in and let it out. One more deep breath in and out. Try to keep breathing this way as we continue, and keep thinking about your most comfortable spot. Now, I'd like you to make a fist and squeeze it really tight. Hold it. Now relax it completely and shake it out. You're going to do it again. Make a fist, squeeze. Now relax it completely. And think, can you feel the difference between how it was when it was tight and now how it feels when it's relaxed? Let's do the same thing for the rest of your arms. Tighten up your whole arm like you're making a muscle and hold it. Now relax it completely. Do it again. Tighten. Now relax. Now, let's move to your shoulders. Bring your shoulders up to your ears and tighten them. Hold it. Now relax. Do it again. Bring your shoulders way up near your ears. Hold it. Now relax it completely. Make sure your hands, arms, and shoulders are completely relaxed. Breathe in and let it out. In and out. Let's work on your face now. Scrunch up your face as tight as you can. Close your eyes tight, scrunch up your mouth, and hold it. Now relax. Try that again. Tighten up your whole face and hold it. Now relax it. Keep breathing like we did before. In and out. In and out. Next comes your body. Arch your back as much as you can and put your shoulders all the way back. Hold it. Now relax that. Next, go ahead and lean forward onto your knees and curl your back the other way. Tighten up your stomach as much as you can. Hold it. Now relax it. Let's do that again. Hold it. And relax it. Keep breathing in and out. In and out. Now let's work on your legs and feet. Straighten your legs in the air or in front of you. And bring your toes as close to your face as you can. Tighten up your legs all the way up to your seat. Now hold it and relax. Do that again. Hold it. Now relax. Next, point your toes as far away as you can from your face. And again, tighten up your leg muscles. Hold it. Now relax. Do that again. Hold it. And relax. Breathe in and out. In and out. Think about all the parts of your body and relax any part that is tight right now. Let all the tension go out of your body. Breathe in and out, in and out. And when you're ready, open your eyes, sit back up, and be a part of the group again. So that is the relaxation activity from this group session 2. And so after you complete this activity, students will review how they feel, maybe before the activity and how they feel now, and you'll discuss as a group how they feel, and if they feel more relaxed, and also how they can use this technique in the classroom when they're feeling anxious or stressed, or even at home. So research and efficacy. There is a lot of research out there that shows that CBITS is indeed an evidence-based intervention. What is nice is that they have done research on many different cultural needs and cultural differences. So for example, using CBITS with Indigenous people, for looking at it for more academic purposes, students who live in low income areas, or students that are immigrants. And so 2 articles that I found interesting were one where they were looking at adolescent girls and child welfare system. And so the objective was to test the effectiveness of using CBITS to reduce symptoms of PTSD and depression and to increase social problem-solving skills for girls involved in the child welfare system, and compare them to participants who are receiving usual care services, and also determine participant acceptability, for example, attendance, retention, and program satisfaction, and treatment fidelity of the CBITS intervention with a sample of girls in this population. So the results of this specific study indicated that participants in the CBITS condition showed significantly greater increase in social problem solving than the usual care condition group. For both PTSD and depression symptoms, there were no significant difference between the 2 condition groups. Both CBITS and usual care participants showed significant reduction in symptoms, but the results also indicated that this intervention is in fact an acceptable model for this specific population. There was also another study that was a statewide implementation of CBITS in Connecticut, and this was in response to Sandy Hook, which was a traumatic event for many people. And so this study described the implementation effort of the first 2 years of CBITS implementation in the entire state of Connecticut, and they wanted to provide initial outcomes at 2 levels. So the initial implementation outcome, the services provided and the fidelity of it, and the child level outcomes, so pre to post treatment child level outcomes related to symptoms and functioning, and also patient satisfaction. So the results showed that children demonstrated significant reduction in child post-traumatic stress disorder symptoms, a 42% reduction, and problem severity, a 25% reduction, and increases in child functioning, about 5% increase. So this really shows that CBITS is a great trauma-informed intervention for students, again, in that Tier 2 and Tier 3 level. So if you are interested in using CBITS at your building, I highly suggest that you head to their website, cbitsprogram.org, and creating a free profile. And again, you can explore all the free material, online training, and seeing if that CBITS is a great intervention for your building. Thank you for listening.